I'm John Painter. I'm one of the consultant gastroenterologists here at Sunderland Royal Hospital. I'm part of the South Tyneside and Sunderland NHS Trust. I'm present both at Sunderland and South Tyneside, and you can find me on either side at different times. As part of the upper GI cancer care here in the Trust, I am the lead for the upper GI cancer and chair what we call the multidisciplinary team, otherwise known as the MDT. So here in our Trust we have over 15 consultant gastroenterologists, all of whom in some way contribute to cancer care. We deal with emergency cases as they come into hospital, and also what we call elective cases, which are people who are referred on an urgent or routine basis. We have very specialised outpatient services available as well, which includes liver specialist clinics, clinics related to non-cancer care such as inflammatory bowel disease. We also have a specialist service for celiac disease and many other specialist services. So our upper GI cancer care incorporates all referrals to our Trust, both on the South Tyneside and the Sunderland site. We are very privileged and lucky to have very good support for our nurse specialists. At present, 3 nurses help contribute to this. In terms of upper GI cancer care, we receive urgent referrals from the GPs and also from other departments such as the emergency department or other consultant teams within the Trust. All of these are screened on a daily basis, Monday to Friday, non-working days, by the consultants. And we try to fast track and direct the care of the patients directly to an investigation to make a quick diagnosis wherever possible. However, if patients express any concern about having tests as the first point of contact, or if patients appear to be frail or there's some uncertainty about their symptoms, then we may arrange telephone contact or a visit in the clinic beforehand to clarify what tests are appropriate for that one individual. Once we have undertaken specialist investigations, we then determine whether patients do or do not have cancer, and those that do are discussed in our MDT, our multidisciplinary team. For those patients with potentially curable cancer, we will refer them up to our regional specialist teams in Newcastle, and if a patient has liver cancer or pancreatic cancer or bile duct cancer, we refer them to the special unit at the Freeman Hospital. And if a patient has cancer of the gullet, known as the esophagus, or cancer of the stomach, we refer them to our specialist team at the RVI Hospital in Newcastle. Unfortunately, not all patients have curable disease, but the cancer can still be treated, and we can offer palliative care, meaning care to improve the quality of life of patients, care to give patients longer to live with their cancer. This can take different forms, but the most common one is chemotherapy, and this is delivered by our oncology specialists here at Sunderland, who work as part of a regional network in the northeast of England. We also at times will offer radiotherapy in specific circumstances for some cancer patients. This is delivered in Newcastle but coordinated by our oncologists. Oncologists are cancer specialists who deal with chemotherapy and radiotherapy treatments. Some patients require endoscopic intervention or placement of stents to relieve blockages which are due to the cancer. This can be done by an endoscopic approach, namely passing a fibre optic camera, and sometimes requires an X-ray approach in our radiology department. These specialist services and interventions are undertaken by gastroenterologists, but also by our GI surgeons and also by consultant radiologists. Which we choose depends on the exact nature of the blockage and where the blockage is in each individual patient, and we try to individualise the approach and do the best for that one individual patient. Thank you.